You wake up every morning with a mouth so dry it feels like you've been sleeping in the desert. Your tongue sticking to the roof of your mouth, your throat's burning, and you're reaching for water before your feet even hit the floor. If you're over 60, this isn't just uncomfortable. It's your body sending you a critical warning signal. According to recent studies from the National Institute of Dental Research, chronic dry mouth affects over 30% of adults over 60, and it can signal everything from medication side effects to diabetes, heart disease, and even Alzheimer's. In the next 15 minutes, I'm going to show you exactly what your dry mouth's trying to tell you, and the 5 steps you need to take starting today. But before we dive in, if you're serious about protecting your health after 60, hit that subscribe button and click the bell icon. I'm Dr. Martin Hale, and here on Dr. Martin Hale Senior Health, I break down the health warnings your body's giving you every single day. Let's get started. Understanding what dry mouth really means after 60. Here's what 90% of Americans don't know. Dry mouth, or xerostomia as we call it in medicine, isn't just about being thirsty. Your salivary glands produce about 1 to 1.5 liters of saliva every single day. This saliva does far more than keep your mouth wet. It's your body's first line of defense against tooth decay, gum disease, infections, and even digestive problems. After age 60, your salivary glands naturally produce less saliva, but when you're waking up with a persistently dry mouth, something else is going on. Let me share a case with you. I had a patient, Margaret, 67 years old, who came to see me complaining about waking up with severe dry mouth every morning for 6 months. She thought it was just part of getting older. When we ran blood tests, we discovered she had undiagnosed type 2 diabetes with blood sugar levels over 250. Her dry mouth was one of the earliest warning signs her body was giving her, and she'd been ignoring it. Within 3 months of treatment, not only did her blood sugar normalize, but her dry mouth improved by 70%. Research from the Journal of the American Dental Association shows that chronic dry mouth increases your risk of cavities by 300%, periodontal disease by 250%, and oral infections by 400%. A 2023 study published in the Journal of Clinical Medicine found that seniors with chronic dry mouth had twice the rate of malnutrition because they couldn't chew or swallow food properly. This isn't just a comfort issue, it's a serious health threat that deserves your immediate attention. Your saliva contains enzymes, antibodies, and proteins that kill bacteria and viruses before they can enter your digestive system. When your mouth's chronically dry, you're losing that protective barrier. You're also at higher risk for bad breath, cracked lips, mouth sores, and fungal infections like oral thrush. The University of Michigan School of Dentistry found that 85% of Americans over 60 take at least one medication that causes dry mouth as a side effect, yet most people never connect the dots. If you're waking up with dry mouth, your body's telling you something needs to change, and ignoring it could lead to serious complications down the road. The 7 hidden causes your doctor might miss. Now let's talk about what's actually causing your dry mouth, because it's rarely just one thing. The first and most common cause is medications. Over 400 prescription and over-the-counter medications list dry mouth as a side effect. We're talking about blood pressure medications like ACE inhibitors and diuretics, antidepressants, antihistamines, pain medications, and even sleeping pills. A study in the American Journal of Medicine found that people over 60 take an average of 4.5 medications daily, and when you combine multiple drugs, the dry mouth effect multiplies. The second cause that 90% of Americans don't realize is diabetes. High blood sugar pulls water out of your tissues, including your salivary glands. According to the American Diabetes Association, nearly 30% of adults over 65 have diabetes, and another 50% have prediabetes. If you're experiencing dry mouth along with increased thirst, frequent urination, blurred vision, or slow healing wounds, you need to get your blood sugar checked immediately. Let me tell you about Robert, a 71-year-old patient of mine. He'd been waking up with dry mouth for over a year. He also mentioned feeling more tired than usual and needing to urinate frequently at night. His doctor had been treating him for an overactive bladder, but when we tested his HbA1c, it came back at 8.2, well into the diabetic range. Once we got his diabetes under control, his dry mouth resolved within weeks. The third cause is autoimmune diseases, particularly Sjogren's syndrome. This condition, which affects about 4 million Americans and is 9 times more common in women, specifically attacks the glands that produce moisture, your salivary and tear glands. The Sjogren's Syndrome Foundation reports that it takes an average of 4.7 years to get a correct diagnosis because the symptoms are so commonly dismissed as normal aging. If you've got dry mouth along with dry eyes, joint pain, or fatigue, you need to ask your doctor about Sjogren's. The fourth cause is sleep apnea and mouth breathing. When you sleep with your mouth open, often because of nasal congestion, sleep apnea, or poor sleeping position, the airflow dries out your mouth and throat. The American Academy of Sleep Medicine found that 60% of people over 60 have some degree of sleep apnea, and most don't know it. If you're waking up with dry mouth, snoring, or feeling unrested despite sleeping 7 to 8 hours, sleep apnea could be the culprit. The fifth cause is dehydration, which is far more common in seniors than people realize. As you age, your sense of thirst diminishes, and your kidneys become less efficient at conserving water. A study in the journal Age and Aging found that up to 40% of seniors living independently are chronically dehydrated. If you're not drinking at least 6 to 8 glasses of water daily, your dry mouth could simply be your body begging for more fluids. The sixth cause is nerve damage from conditions like Parkinson's disease, stroke, or Alzheimer's. These conditions can affect the nerves that signal your salivary glands to produce saliva. The Michael J. Fox Foundation reports that 70 to 80% of people with Parkinson's experience dry mouth at some point in their disease progression. The seventh and often overlooked cause is cancer treatment. Radiation therapy to the head or neck can permanently damage salivary glands, and chemotherapy can temporarily reduce saliva production. According to the National Cancer Institute, up to 80% of head and neck cancer patients who receive radiation therapy develop severe dry mouth. The dangerous complications you need to know about. Here's what 85% of Americans don't do. They don't treat dry mouth seriously until it's too late. Let me explain the cascade of problems that chronic dry mouth creates. First, your risk of tooth decay skyrockets. Saliva naturally washes away food particles and neutralizes acids produced by bacteria in your mouth. Without adequate saliva, bacteria thrive and cavities form rapidly. The American Dental Association published research showing that seniors with chronic dry mouth lose an average of 2.3 more teeth per decade than those with normal saliva production. Second, you're at massive risk for gum disease. Periodontitis, the advanced form of gum disease, is directly linked to heart disease, stroke, and diabetes complications. A landmark study in the Journal of Periodontology found that people with severe gum disease had a 49% higher risk of kidney disease, 54% higher risk of pancreatic cancer, and 68% higher risk of respiratory infections. Your dry mouth isn't just affecting your mouth, it's putting your entire body at risk. Let me share another case. I treated a patient named Eleanor, 73 years old, who had been dealing with dry mouth for 2 years. She didn't think much of it until she started developing recurrent urinary tract infections and pneumonia. When we investigated, we found she had developed oral thrush, a fungal infection in her mouth, which was spreading to her throat and affecting her immune system. Once we addressed the dry mouth and treated the infections, her overall health improved dramatically. Third, dry mouth makes swallowing difficult and painful, leading to malnutrition. When you can't chew or swallow properly, you start avoiding certain foods, particularly proteins and vegetables. A study in clinical nutrition found that seniors with chronic dry mouth consumed 30% fewer calories and 40% less protein than their peers, leading to muscle loss, weakness, and increased fall risk. This creates a vicious cycle. Poor nutrition weakens your immune system, making you more susceptible to infections, which further compromises your health. Fourth, chronic dry mouth significantly impairs your quality of life. It affects your ability to speak clearly, taste food, and even sleep through the night. Research from the Journal of Oral Rehabilitation showed that people with severe dry mouth had quality of life scores comparable to those with chronic pain conditions. They reported higher rates of depression, social isolation, and anxiety because they felt self-conscious about bad breath and difficulty speaking. Fifth, and this is critical, dry mouth can be a warning sign of medication toxicity. If you're taking multiple medications and suddenly develop dry mouth, it could mean your drug levels are too high or that you're experiencing dangerous drug interactions. The Institute for Safe Medication Practices found that medication-related problems cause over 100,000 hospitalizations annually in people over 65, and dry mouth's often one of the first warning signs. The 5-step action plan to fix dry mouth starting today. Now let's get to the solutions. The practical steps you can take starting right now to address your dry mouth and protect your health. Step 1. Review your medications with your doctor. Make a list of every prescription and over-the-counter medication you're taking, including supplements. Bring this list to your doctor and specifically ask, could any of these be causing my dry mouth, and are there alternatives? Sometimes simply adjusting the timing of your medications or switching to a different drug in the same class can make a huge difference. I had a patient, Thomas, 69 years old, who was taking an older antihistamine for allergies. When we switched him to a newer, non-sedating antihistamine, his dry mouth improved by 60% within 2 weeks. It's a simple change that many doctors are willing to make, but you've got to ask. Don't stop any medication without consulting your doctor, but do have that conversation. Step 2. Get tested for underlying conditions. Ask your doctor to check your fasting blood sugar and HbA1c to rule out diabetes or prediabetes. Request tests for thyroid function, vitamin deficiencies, particularly B12 and iron, and if appropriate, screening for autoimmune conditions like Sjogren's syndrome. The earlier you catch these conditions, the easier they are to manage. A comprehensive blood panel costs less than $200 in most cases and could save your life. Step 3. Optimize your hydration strategy. Don't just drink more water randomly, be strategic about it. Start your day with 16 ounces of water first thing in the morning. Set reminders on your phone to drink 8 ounces every 2 hours throughout the day. Avoid caffeine and alcohol in the evening, as both are diuretics that worsen dehydration. A study in the British Journal of Nutrition found that drinking water at specific intervals throughout the day was 40% more effective at maintaining hydration than drinking the same amount sporadically. Keep a water bottle with you at all times, and if plain water's unappealing, add lemon, cucumber, or a splash of fruit juice. Eat water-rich foods like watermelon, cucumbers, oranges, and soups. Research from the European Journal of Clinical Nutrition shows that about 20% of your daily water intake should come from food, not just beverages. Step 4. Use saliva substitutes and stimulants. Over-the-counter saliva substitutes like biotin or xylemelts can provide temporary relief, especially at night. Sugar-free gum or lozenges containing xylitol stimulate saliva production and help prevent cavities. The Journal of Dental Research found that chewing xylitol gum for 5 minutes after meals reduced cavity formation by 70% in people with dry mouth. Your doctor can also prescribe medications like pilocarpine or cevimeline that stimulate saliva production if over-the-counter options aren't enough. Step 5. Improve your sleep environment and breathing. If you suspect sleep apnea or mouth breathing, talk to your doctor about a sleep study. Use a humidifier in your bedroom to add moisture to the air. Aim for 40 to 50% humidity. If you've got nasal congestion, address it with saline rinses, nasal strips, or medications recommended by your doctor. Elevate the head of your bed slightly to reduce nighttime reflux, which can worsen dry mouth. A study in sleep medicine reviews found that addressing sleep-disordered breathing improved dry mouth symptoms in 65% of patients within 3 months. Long-term prevention and when to seek emergency care. Let's talk about long-term prevention and the warning signs that require immediate medical attention. For long-term prevention, maintain excellent oral hygiene. Brush at least twice daily with fluoride toothpaste, floss daily, and use an alcohol-free mouthwash designed for dry mouth. The American Dental Association recommends using a soft bristled toothbrush and being extra gentle, as dry mouth makes your gum tissue more fragile. Visit your dentist every 3 to 6 months instead of the standard 6 to 12 months. Tell your dentist about your dry mouth so they can monitor for early signs of decay or gum disease. Ask about fluoride treatments and prescription strength fluoride toothpaste, which can help protect your teeth. A longitudinal study in the Journal of the American Dental Association found that seniors with dry mouth who received preventive dental care every 3 to 4 months had 80% fewer cavities and 60% less tooth loss over 5 years compared to those who went annually. Avoid tobacco and limit alcohol consumption, as both significantly worsen dry mouth and increase your risk of oral cancer. According to the Centers for Disease Control, people who smoke and have chronic dry mouth have a 15 times higher risk of oral cancer than non-smokers without dry mouth. If you currently smoke, talk to your doctor about cessation programs. It's never too late to quit, and the benefits start within days. Manage stress through techniques like meditation, gentle exercise, or hobbies you enjoy. Chronic stress triggers your sympathetic nervous system, which reduces saliva production. A study in psychosomatic medicine found that people who practiced daily stress reduction techniques had 35% improvement in saliva flow within 8 weeks. Now, when should you seek emergency care? If you develop sudden, severe dry mouth along with difficulty swallowing, breathing problems, or swelling of your tongue or throat, call 911 immediately. This could be a severe allergic reaction or medication reaction. If your dry mouth's accompanied by severe abdominal pain, vomiting, or signs of severe dehydration, such as dizziness, rapid heartbeat, confusion, or dark urine, go to the emergency room. These could be signs of diabetic ketoacidosis or other life-threatening conditions. If you notice white patches in your mouth that don't scrape off, persistent sores that don't heal within 2 weeks, or unexplained lumps or bleeding, see your doctor or dentist within 24 to 48 hours. These could be signs of oral thrush, oral cancer, or other serious conditions that require prompt treatment. Listen, your dry mouth's not something to ignore or accept as normal aging. It's your body's way of telling you something needs attention, and now you've got the knowledge and tools to do something about it. If you found this information valuable, do me a favor. Subscribe to Dr. Martin Hale Senior Health and share this video with someone over 60 who needs to hear this message. Every week, I bring you life-saving health information designed specifically for seniors. Hit that bell icon so you never miss a video, and drop a comment below telling me, are you experiencing dry mouth, and what's your biggest concern about it? I read every single comment and often create videos based on your questions. Remember, you've got more control over your health than you think. Small changes today can prevent serious problems tomorrow. Take action, talk to your doctor, and don't let dry mouth rob you of your quality of life or your health. Until next time, this is Dr. Martin Hale reminding you to take care of yourself. You're worth it.